Hello, dentalunboxing.com subscriber. It's Tim Kosinski again, one of the clinical evaluators with dentalunboxing.com. Thanks for joining me again today for another dental product unboxing and clinical evaluation. So let's get to it. Today I'm going to unbox and going to clinically evaluate in my practice a product from Impladent located in New York called the Osteogen plugs, which are used for socket preservation as a bone graft. Let's see what's in the box. So you're going to get a package from Golden Dent, and you or your team is going to simply open it, and you'll get some product. It's a series of plugs that you will be able to use in socket preservation that we'll demonstrate clinically. Now what's important is there are two sizes. There's a wide body, which can be used for larger areas like molars, and a thinner product which is used for anteriors or bicuspid teeth. It looks like a collagen plug, but it isn't. It has a much firmer consistency than a collagen plug. And you can see how I'm going to open this package here. It's sterile packaged, and you just have a little wing here, and you or your team will simply adhese it and drop it on the table. Now you're not going to want to touch this with your hands, but the material has a firm consistency. Not like chalk, but not like a collagen plug. But it is very easy to cut it with a scissors, so you can actually design it. If you had a molar tooth with two roots, you could simply cut it, make it look like the roots that you've taken out, and insert it. Now you're going to insert this by condensing. You're not using, it's not like amalgam, you're not condensing it like amalgam, you're not crushing it, but you're firmly placing it into the socket at the height or slightly above the height of the crest of the ridge. It is ideal for teeth that are removed where all the walls are intact, where you certainly have a socket or a waffle cone or ice cream cone. This material will convert to a bone in a very short amount of time, in 3 or 4 months. And what's nice is you can radiographically, objectively look at your radiographs and determine how bone is going to turn over. It is a calcium apatite material, so it's a synthetic material made in a laboratory. So many of your patients who may be adverse to human or cow or pig or horse materials will feel very comfortable in using it. It will absorb blood very well. And what I like to do is once the material is placed, I will put a couple interrupted sutures over the top of it so it can't escape. Remember, epithelium grows very fast, 0.5 millimeter to 1 millimeter a day, and certainly over a period of time, the tissue, the epithelium will grow over the top of this material. Now what's nice is you don't need a membrane with this. Because of the complexity of the calcium apatite in the bovine Achilles tendon matrix, epithelium has a choice. It can either go into the material or grow over the top. Epithelium will follow the path of least resistance and will simply grow over the top of the material. So big advantage. Another big advantage is it's relatively inexpensive compared to more conventional allograft and membrane placement. So it's a wonderful material to use for socket preservation for your patients, especially those who may consider dental implants in the future. I am excited to clinically evaluate and document this product in my practice for dentalunboxing.com. So this is what it looks like. It looks like a collagen plug, but it is not a collagen plug. And just remember that there's a lot of confusion out there on different products, and collagen plugs are not socket preservation or grafting materials. They're normally derived from bovine dermis, but they resorb so quickly. Many of them turn to snot literally in a few days. So it's not really going to protect the graft material from invagination of epithelium. But this material is very special. And you can see I actually cut it to make it look like the root of a tooth. Once it's cleaned out, you can see I'm taking my Osteogen plug that's been trimmed into 3 pieces, and you can see I'm slowly just placing it into the socket, and it's absorbing the blood. Absorbing the blood. And then I'm going to pack this material firmly. We're not crushing it. It's not amalgam, but I want to pack the material firmly to the crest of the ridge.
Now there's no membrane involved here, so I'll just put a couple of simple interrupted sutures. And very, very quickly, I want you to see how I'm doing the suture. I'm taking my needle, which is a reverse cutting needle, from the crest, and I'm actually penetrating through the facial tissue. Thus, I am eliminating grabbing onto the graft material. I'm going to turn the needle around and do the same thing. Go from the crest of the socket to the palatal in this situation, and simply do some cross sutures to maintain that graft material into the site. You can see it's radiolucent immediately after extraction.
Hello, dentalunboxing.com subscriber. It's Dr. Tim Kosinski, and I've completed my clinical evaluation of the Osteogen plug from Impladent. So again, let's summarize the 5 main factors I considered. Number 1, did this product save me time? Wow, it sure did. The material is a synthetic material, calcium apatite. It's been used apparently for many years. It's a simple material to use, chair side. There's no mixing. It comes in a small and a large plug. And as I was told, when we do an extraction technique where we have our sockets in place, we definitely want to fill that socket with something to minimize future bone loss. We know that bone's going to shrink down and in or up and in over time. And especially I do a lot of dental implants, maintaining that the quality and quantity of bone is very important to me. So if I have an extraction, I curette the area, and I'm able to take this plug and simply place it with a plugger firmly, but not too dense, in the socket, and I just suture over the top of it. It saves me a lot of time compared to the more conventional techniques of using an allograft material, which I would have to wet, and then when we do an allograft material, we have to do a membrane, which oftentimes means I need to reflect the tissue and then suture over the top. So it saves me a lot of time, and it's not a very expensive procedure. Was it easy or difficult to integrate into my practice? This is probably one of the simplest things I've ever integrated in my practice. Again, I do a lot of extractions, and having a socket and being able to simply take this plug and place it into the socket is as simple as you can get. You don't need a membrane with this product, we're told, because of the Achilles tendon matrix. It kind of allows the epithelium to grow over the top of it. The epithelium has 2 choices. It can go into it or over the top. And epithelium is always going to follow the path of least resistance and grow over the top. So not having to put a membrane and go through the cost of a membrane is remarkable. So I give it a 5, being as simple as possibly can be. Cost, boy, compared to allograft and a membrane, it's a fraction of the cost. And seem to work very well in my hands. So it is very reasonably priced, something that you will use every day in your practice because it's so easy to use. How does it compare to other techniques? Well, the more conventional techniques today, as I mentioned, is to use an allograft material or human bone, which some patients will not agree to. We have to wet it with sterile water, sterile saline. We would have to pack it, and we'd always have to protect that allograft material with some type of membrane. That adds a lot of cost and time to the procedure. So I would say this technique, this material is much better than the current techniques. I don't know if I would use it necessarily for facial wall defects, where the facial wall is missing. I don't know if the research backs that up, but they tell us that if the defect on the facial is 4 millimeters or less, then we can use this. But I would say if I was going to use it where a facial wall was missing, I would place it, but then I would go ahead and reflect the tissue and put a membrane. It's still much more cost-effective treatment. It just you have to take an extra step if the facial wall is missing. Would I purchase it in my practice? Absolutely, something I'd want in my practice to use just about every day. If you're doing extractions and you want to maintain the hard tissue, if you're going to put implants in the future, we get turnover in a very short amount of time, in a matter of months, and will allow you to provide excellent treatment to your patients. So yes, I would use it in my practice. So overall, I give the Osteogen plug, the Dental Boxing Com Golden Tooth, and I would highly recommend it to any of my colleagues out there that are doing extractions and grafting and implant procedures. And again, thank you for watching today, and please hit the subscribe button to get any notification on future videos that we're posting.